That tumor could have been there at least 10 years.
Wow.
Yes, and I had no idea.
Ganella Anderson is just one of nearly 64,000 Americans who will be diagnosed with renal cell carcinoma this year, and many of whom have very similar stories to Miss Anderson. Renal cancers have been called the internist's tumor because they are among the great mimics in medicine and present with systemic symptoms unrelated to the kidney cancer, such as hypertension, hypercalcemia, or a fever. Cancer is most commonly detected during screening or scans for other underlying conditions. The most common treatment form remains removal of the affected kidney, along with any other parts of the digestive tract that may have been impacted by the tumor. While this is the standard course of treatment, it puts the patient at risk for lifetime dialysis should anything happen to the second kidney. Here are some known risk factors for renal cell carcinoma. Recent research has focused on factory chemical exposure, and PFOA has emerged as a candidate. PFOA is a synthetic chemical used in various household and industrial products. Animal models have associated this chemical with increased risks for kidney disease in rats, and its metabolites are often concentrated in the kidneys of those animals.
Problem is, look at the coating. See that little lining they have? That's called PFOA. That's why the oil doesn't get on your fingers when you open the popcorn. The problem with PFOA is 20% of all this chemical in our bodies comes from microwave popcorn.
Upon heating of the bag, PFOA breaks down and gets into the popcorn kernels prior to consumption. Given the amount of popcorn that Americans consume on a yearly basis, it is important to look at the association between this dangerous chemical and cancer. This study aims to look at the association between microwave popcorn and renal cell carcinoma. 200 incident cases of RCC will be taken from 5 Bay Area hospitals: Stanford Hospital, Kaiser San Francisco, SF General, Mills Peninsula Hospital, and UCSF. 400 controls will also be taken from family medicine clinics in those hospitals, excluding patients who were there for nephrology concerns. The study methodology involves 3 parts. First, we will be taking the blood measurements of each participant's PFOA levels. Secondly, we will be administering a survey asking about general diet, but with a focus section on microwave popcorn. We'll be stratifying responses based on the number of bags participants say they consume in a week. Lastly, we will take the top 10 Amazon best-selling brands of microwave popcorn and send those off to a lab to measure content of PFOA in each of those bags. Our data analysis for this study will include calculation of an odds ratio along with the 95% confidence interval. We will also use logistic regression to account for some of the following biases and confounders. The use of 5 diverse Bay Area hospitals will help us to reduce and account for the effect of selection bias. We will also account for prevarication bias in reporting of popcorn consumption through measurement of blood PFOA levels of all participants. Lastly, during data analysis, we will also have to account for recall bias. One possible confounder to PFOA exposure is the use of Teflon and nonstick frying pans, which also contain trace amounts of the chemical. To account for this, we'll be asking about nonstick use in our survey. Lastly, we'll have to account for cigarette and tobacco use, which are known risk factors for renal cell carcinoma, and we will see if there's an interaction with PFOA and cigarettes. We will also be asking about cigarettes in our survey. The study will begin with 2 months of preparation time, 20 months of participant recruitment, and 2 months of data analysis. A positive association between renal cell carcinoma and microwave popcorn would result in major FDA regulation of the industry. We also hope to encourage families to find healthier snack alternatives and to help reduce the incidence of this very preventable cancer in our children and future generations.